My name is Aysha Badat. I am a student nurse at the Salford University. All my placements are based at the Royal Bolton Hospital purely because I live in the Bolton area. I started at Salford University about a year and a half ago in September 2007. It's been an extremely good experience, to be honest. In the last year and a half I have learnt and feel professionally and personally I've developed a lot. The Excellence Award that I won was the Jackie Solomon's Award.
Just to reassure.
The award really came from my mentor and the practice educator here, really, because they felt that I was an outstanding student that exceeded me first year level competencies, and also that the fact that I went the extra mile to work with patients and did more than a first year student would probably be expected to do in their first year. Often you feel when you're out on placements that you're doing so much work but no one's actually acknowledging what you're doing. You get the thanks, etc. from the patients, but often from a professional point you don't feel as recognised because you don't feel valued, in the sense because you're not registered staff yet. So in that sense it's been very rewarding and an honour and a privilege. There's no other words for it, really. I've had plenty of good experiences here at the hospital. The main ones that come to my mind really is, of course, the breast unit. I dealt with a lot of breast patients and I actually followed a patient through to the ward. So I actually watched her surgery, then I went onto the ward to support her post-surgery, and then I saw her again when she came back as an outpatient to the breast clinic. And what was good about that journey was the fact that I built a good relationship with my patient. She trusted me to take whatever questions that she had and get support if needed and answer them. At any point that you need to talk to someone. We've done a lot around communication and communicating with patients, and I think that's probably the main thing that comes in your first year as a nursing student: communication and patience. And during my experience with the intensive care unit, it was difficult because a lot of the patients that I dealt with were unconscious. However, it didn't stop me from talking to them, though they were unconscious. And one highlight of it was there was just one gentleman that comes to my mind, and I actually went back to him to introduce myself when he was awake, introduced myself again and explained what was going on with him, and he says, "Oh, I remember you, you were speaking, you know, and you were speaking to me whilst I was unconscious." And I think that was, it just made me smile because it touched my heart, because I thought, I didn't think at all that this gentleman would remember anything about his care or things that I might have been talking to him about. It might just be the weather, for instance, telling him what day it is and what the weather's like outside, what time it is, what we're doing for him that particular day. Little things like that makes you realise that that relationship you build with them will stay with them and they'll remember that throughout their life.